Good morning and welcome to today's Recovery Summit presentation, Amyl and the Sniffers. This webinar is a part of a series hosted annually by St. Clair County Community Mental Health during the month of September, which is National Recovery Month. Today's session is being recorded and will be uploaded on the Community Mental Health of St. Clair County YouTube channel for future reference. Please feel free to use the chat box for any questions or comments during the webinar. Our presenter will be answering questions as time allows. Continuing education credits are offered for today's presentation. If you're requesting professional credits, you must remain on the webinar for the entire time, and please complete the survey at the end of the presentation to receive credit. And with that, today, I'm going to turn our presentation over to Dr. Brandon Moore. Dr. Moore is the medical director here at St. Clair County Community Mental Health. Welcome, Dr. Moore.
Thank you, Adrian. Good morning, everyone. So welcome to the presentation, Amyl and the Sniffers. So we're going to focus on primarily amyl nitrates, but also other inhalants. So some of you may be wondering where the name Amyl and the Sniffers came from. So one, I thought it was catchy, but as I was doing research on this topic, it actually came up as a name of a rock band. So this is a pub and punk rock band based out of Melbourne, Australia. So I thought it was a bit catchy to keep everybody's attention. So let's jump in. So where did inhalants first, originate? So they've actually been around for a long time. This isn't necessarily a new thing. Nitrites were first discovered back in the mid-19th century. More, modern, glue inhalants, glue sniffing became prevalent around the 1960s. And then the more popular aerosols were started in the 70s and then more present. So what's the prevalence of this? So 2020 survey, this was the most recent I could find, indicated 2.4 million in the US over the age of 12 had used an inhalant in the past year. So, that was the other reason I kind of brought this presentation forward is I had a couple of cases, and you'll see some case examples at the end. But I think it's a blind spot to not only a lot of us in the community, but even professionals like myself. I think this often goes ignored. We ask a lot about other substance of abuse, but I think we tend to ignore the inhalants. So age of use, typically this is often the first substance of abuse. So young teens, preteens, most common age bracket is going to be 12 to 17. But data shows individuals as young as 5. Even I was quite surprised at that. But then use can, it certainly doesn't cut off at 17. That use can, progress well into adulthood as well. So there's a lot of slang terms out there, other than just inhalants or nitrites. Whippets, duster, hippie crack, moon gas, poppers, poor man's pot, chroming. And some of those specify, particular inhalants. Duster is obviously computer duster. Whippets is the whipped cream canisters. Poppers is the amyl nitrites we'll talk about. And then some are more, generic. Hippie crack, poor man's pot. Those are more generic just for inhalants in general. So they tend to break down into 4 general categories. So you have your aerosols, paint, different sprays, whether that be oven cleaner spray, vegetable oil, air fresheners, deodorants, and then gases. Again, the computer duster that I mentioned, also butane, laughing gas, propane even, and freon and helium. And then your solvents, so glues, markers, gasoline, nail polish remover, paint thinners, degreasers, and even correction fluid, or whiteout, as most of us know it. And then the amyl nitrites that we'll spend a lot of time on today. And those are marketed, generally not legal, but they're not necessarily listed, as nitrites. They're marketed as different things, video head cleaner. Yeah, some of us younger than me may not be familiar with video head cleaner, but that refers to the old VCRs. Leather cleaner, poppers, snappers are also more common slang terms. Also sold as room aromas and deodorizers, which they have no legitimate use for that. So methods of use, a lot of different ways these are used. Snorting, directly inhaled into the nose, dusting, which is more, instead of spraying into something, directly spraying the aerosol into the nose or mouth. Huffing, so soaking a rag or any other object, holding that to the face, or even stuffing it in the mouth while inhaling the fumes. Glading, that typically obviously refers to more directly air fresheners. And then you get into ballooning or bagging. Ballooning is filling a balloon, and inhaling, or bagging, filling a paper or plastic bag and then sucking in the fumes. So the effects or the high, that they're getting from this. So rapidly absorbed into the lungs, and very rapidly, reaches the brain, matter of seconds. And this poses a problem from an addiction standpoint. A lot of other substances, pills, even marijuana, those things take longer to absorb, versus inhalants, which are very rapidly and directly, reaching the brain and stimulating that reward pathway. So they cause a euphoria, an excitedness, happiness, similar to other intoxicants. They do release dopamine, so that feel-good chemical in the brain, also, attributing to their addiction and the high. They are short acting, typically only a few minutes, which often leads to then repeated use, to continue to get that, high. And then nitrites, those act a little differently. Those do have more physical effects, than just the effect on the brain. So we'll certainly talk about those as we get into the nitrites. So harmful effects of inhalants, at their worst, they can cause death. That's typically secondary to either heart arrhythmias of various types, and then also suffocation. Now, that suffocation can be direct or indirect. By that, I mean indirect, the bagging that I mentioned earlier, putting a bag over their head with that inhalant in it, and then they can suffocate on the bag itself. The indirect is actually, due to competition for oxygen in the body. So as they're using these inhalants, they become so powerful, that they can actually override and overbind the oxygen in the body, not allowing the body to process the oxygen you're breathing in, thus causing indirect suffocation. So, these are not to be ignored. They can have very serious consequences. Also coma, hearing loss. Often early on, you'll see mood changes, including violence, confusion, depression. I didn't list it here, but also anxiety, and then hallucinations. They can cause nerve damage, especially over time, leading to numbness, weakness, tingling, and even tremors. Also, as you see, loss of bowel and bladder, they can damage the liver and bone marrow. So what are we looking for, in signs of use? How can we identify that somebody's using these? So often you'll see, rash or blistering on the face and hands. The most common people look for is the face. I actually look to the hands. I used to do a lot of ER work, and I would see the hands more commonly. Typically with the duster. That duster, as they press the nozzle and hold their finger to it, it becomes so cold that it actually causes a cold blister on the fingers. So you can see that pretty readily. And it's typically going to be the thumb and index finger. So if you don't see it, on face, lips, tongue, look to the hands. And then also paint staining on clothing or skin. That's there was a term earlier on in the presentation, I believe chromia. When they're using paint in particular, look for the silvers, golds, chrome tones. Those have more volatile chemicals. So if they are huffing paint, those brighter colors tend to be more popular. So sometimes you can see that in the staining. Also very rapid, actually, loss of appetite and weight. Often you'll see or smell odor on the individual of the chemicals that they're using. Some have less odor to them. The whippets and things don't have much odor, but obviously the gasoline, solvents, those are going to have quite an odor to them. Persistent runny nose or cough, watery eyes, again, the hallucinations, and then just general behavior. As we would see with a lot of substance use disorders, preoccupation with finding that substance, buying high quantities of paint, duster, other things from the store for unexplained reasons, and then the hiding behavior, hiding containers, rags, other things around their house, car. So I guess I was going to move into amyl nitrites, but Adrian, maybe we can take just a moment to pause and ask any kind of general questions on inhalants before we specifically move into the amyl nitrites.
Is there any time let's see. Okay, here's a question. Let's see. So you're coming from a health standpoint. So from a health standpoint, are you aware of any drug testing methods or testable substances that may appear? This individual is that asking a question that says, I work with the drug courts and we have been having multiple people use inhalants, more particularly dusters, but due to the extremely low threshold for standard urine tests and not showing up in tests. Unsure if there is any new methods to test better for inhalants or particulars that might show up in extended drug tests. Thanks, long question. I appreciate it.
Oh, in fact, that's actually a very good question. And another reason why these are popular is they've go undetected. Even on our more specific send out substance use testing, generally we're not able to find these. They can be tested for, is my understanding, but again, going back to what I said about how fast they go into the system, but more importantly, how fast they come out of your body or are processed. By the time you test, they're long gone, is the short answer to that. I wish there was more specifics. I'm ever on the lookout for more specific testing that can show us these things, but as of right now, no, I'm not aware of any. But great question.
Next question is, what's the best way to ask about this type of use?
So another good one. So I've really just started to ask it along with my other substance questions. Generally I'll start with, um, I used to ask about tobacco, but I've learned to rephrase that even to say any nicotine products. And that way I pick up more of the vaping of nicotine. And then I'll move into alcohol, marijuana, and then other things. I'll say, are there any pills that you use that aren't prescribed, or in methods that aren't prescribed? And then I'll just say any inhalant use. And I just I don't hide it. I come right out with it and am direct with that question.
Great. Next question. How addictive are these substances? Do they need to rehab quicker do they need to rehab to quit like other drugs?
So yeah, kind of a two-part question there. Some of them are highly addictive, others less so. The nitrites aren't quite as addictive, but others are, particularly the aerosols, the gases. Those can actually become quite addictive, because they produce anything that produces that rapid high. And we can have a separate discussion on another lecture about other substance abuse such as benzodiazepines. But when we look at that, the ones that are more addictive are the more rapid acting. Anytime you strike that reward system, in the brain in a faster manner, it's going to be more addictive. To the other part of that question, rehabbing, yes, these individuals, it is a substance use disorder. It really shouldn't be looked at any differently. They can still benefit, and I'll comment, later on, but they can still go through 12-step programs. They could still go to NA meetings and others. And do benefit from, the cognitive behavioral therapies and others that we would treat addiction with.
Next question is how major are the withdrawals?
Less so than you would typically see. Certainly not what you would see with like an opiate withdrawal. There's not going to be a lot of withdrawal symptoms. There will certainly be cravings for the substance of choice, but not a lot of physical withdrawal symptoms, no.
Someone asked, I'm sorry if I missed it, but what are the high effects that they're getting from this? And how does one usually act or behave when they're using?
Yeah. Yeah. So I can actually go back to that. So, similar to other intoxicants, you're going to have that euphoria. That's part of what, they're looking for. Part of that, is due to the dopamine release. And that's, I guess that's the good that they're looking for, the euphoria. But then there's the bad, the other things we mentioned, regarding, anxiety, depression, withdrawal. And sorry, I lost my train of thought, and there's something else I was looking for. Oh, hallucinations that can occur.
All right, we're good for questions now. Thank you.
So let's talk specific about amyl nitrates. So these are another inhalant. So their overall class is actually alkyl nitrite. Amyl nitrite is just one of those, but you can also have the butyl, isobutyl, and isopropyl. These are a vasodilator, and that becomes important later on. They're a depressant, so they slow messaging between the brain and the body. Again, first discovered mid-19th century, 1844. There are a few legitimate medical uses, unlike the other inhalants we've talked about. These actually do have some legitimate use. So first synthesized by a French chemist. So what do they look like? Generally come in these small little vials here. And you can see the colorful labels, the various names. You can see Rush, Jungle Juice, I think that one says Super Rush. So they're actually more of an oil, generally clear or yellowish, have a very distinct smell, often fruity or sweet, but some are more, have been described more of like a dirty sock smell. So street names for these, one of the most common is poppers. And that actually came about for a reason. Generally, they weren't in the bottles that you see. That's a more modern iteration. When they first came out, they were actually in a glass vial, and that they were a thin glass that had to be cracked or popped. So that's kind of where that name originated. And then you see some of the names here, either kind of branded names or other street names: Jungle Juice, Liquid Gold, Purple Haze. So I mentioned there are some legitimate clinical uses of this. They can be used to treat angina or even cyanide poisoning, but certainly not commonly used for that. More so recreational used. Generally, the most common is actually inhaled for sexual experiences or general sense of pleasure. I mentioned that they were vasodilators and slowed messaging. So, used in particularly male to male sexual contact, vasodilator, less pain in that activity and things. So you'll see that in that population as a common recreational drug. And then also just as a, quote unquote party drug. And that's more, recent. So how easy are they to obtain? So, typically sold in sex shops, but also you'll see them under the counter, gas stations and other locations where they're sold more nefariously. So, back to the point of addiction, withdrawal, tolerance, nitrites don't cause the same addiction and withdrawal. They aren't thought to do that, but can cause a tolerance where they need more and more of the same substance to get the same effect. So how are the nitrates used? Typically sniffing directly from those small vial bottles that I pictured earlier, but you can also soak a cloth and breathe in the fumes. And then I have not come across this, but in my research, I did see the dipping of cigarettes in the liquid and then sniffing it. However, extremely dangerous if that is then lit, as this is a highly flammable liquid or oil. So specifically the high associated with amyl nitrites, the high occurs within seconds, may only last a few minutes, causes a feeling of happiness, increased sexual drive, lowers inhibitions, and impairs judgment. So, you can see the high and why it's related to specifically sexual practices in the impaired judgment, lowered inhibition, increased drive, feelings of happiness, but also has to be used very frequently throughout in that it's very short acting. So side effects from this, rapid pulse, flushing, typically in the face or neck, headaches, can cause nausea and vomiting, restlessness, and then problems with vision, light sensitivity, and blind spots. And then the more serious risk, So overuse or continuous use can cause damage to the brain, easier transmission of sexually transmitted diseases. There have been cases of sudden death, so the heart abruptly stopping beating. And then meth hemoglobinemia. I'm gonna try my best, even myself, on that one. Blood disorder caused by inadequate oxygen. So this goes back to that suffocation and things that we mentioned earlier, in that it's a competitive inhibitor of the oxygen in your body. Similar to what you would have with carbon monoxide poisoning. And then maculopathy, or loss of vision. That's more with the isopropyl than it is the amyl nitrite. So, medical conditions where somebody would be at higher risk if they were using these, certainly pregnancy, if they already had a pre-existing heart condition, hypertension or anemia, and then if they have an existing intracranial pressure, because it does raise that intracranial pressure even higher. So signs of use specifically with the amyl nitrites, again, skin rashes, and then chemical burns. Typically, again, you're going to see this around the nose or mouth where it's inhaled. There are some drug-drug interactions to be aware of. So if somebody's using this, if they're on stimulants, again, you would be concerned about that hypertension or tachycardia, and cardiac arrest. And then also if they're on medications for erectile dysfunction. So, using these together with erectile dysfunction medications can lead to rapid drops in the blood pressure, stroke, myocardial infarction or heart attack, and even death. This is more general treatment, but applies to amyl nitrates as well, but general treatment for substance use and inhalants. So as I mentioned, they still respond to the cognitive behavioral therapy, general substance counseling, support groups, 12-step program, including sponsors. Counseling of the family is always important. I don't want to ignore that. Typically there's, as you see with the case example, there's an extensive family history of not only substance, but also mental health. So counseling the family can be important in addiction, and should not be ignored, just to focus on the individual. And then often they respond quite well to motivational intervention. Motivating them to be a part of their addiction, be a part of their treatment, be active in their recovery. And then how can they receive help? So 988 was rolled out as the national generally crisis and suicide hotline, but in research they did identify that they can help with substance use as well. And then there's also the SAMHSA hotline, national helpline, NA groups, and then ourselves here in the community as community mental health. So that is all I have, but I'd certainly love to open it up to discussion and questions.
Great. So we do have some more questions, Dr. Moore. And just as a reminder for all of our attendees, if you want to go ahead and use that chat for any questions that you have for Dr. Moore. All right. So one of the questions is, you had mentioned, Dr. Moore, that it's actually Sniffers are a legal substance, and that a lot of times you can find them in sex shops or at gas stations or things like that. Is that available for any age to buy, or is it something like cigarettes and alcohol where you have to be a certain age to buy?
So to my knowledge, there's no age restrictions. The legality is, shall I say, questionable. It's one of those that kind of like Kratom and others that you'll find out there, where it's not really illegal, but they're pretty commonly found in these locations.
Someone asks, is it the case that inhalants do more physical damage to the brain than other drugs?
Um, in general, yes, actually. Um, there can be a lot of physical damage to the structure and pathways of the brain versus other chemicals.
This is talking a bit about prevention. In recent years, I've noticed age requirements to purchase some aerosol products. Has this type of prevention increased with retailers, and or has it been proven effective for treatment or prevention?
Great question. I will say I've personally experienced that, buying, I'm, you know, I take care of my own vehicles and stuff and, buying things like gas treatment, fuel cleaner for your car. I actually was flagged at Walmart for buying that and had to provide an ID. So they are IDing for a lot of these substances that can be used as inhalants. Um, as far as data, I have not found a lot of good hard data on how effective that IDing is. Um, I will say, I'm certainly a believer in that. But I, unfortunately, I didn't find any good data on how much that has changed the situation. I will say, some of them obviously, are pretty difficult, like whippets, whipped cream canisters. Obviously that's something that's not ID, easy to buy. I will comment easy to shoplift. One of my first jobs actually was in a grocery store. And I can recall even back then we would find, empty canisters even in the store. They'd walk by the shelf and, you know, grab it, use it, and, toss it on another shelf. So these, they're really easy to get a hold of, and even easier to disguise, which makes it challenging, certainly.
With ceasing behavior using inhalants, is there any information that points to that there's an increase in suicidal ideations?
I have not seen a direct tie to that. Certainly, something I'm always keen to. Adrian and I were actually having a discussion about suicide prior to this lecture. So something I definitely keep a very close eye on, but no, interestingly enough, I've not seen a tie to increased suicidality with these.
And just to comment on that conversation that we had before the presentation, Dr. Moore, you had said that you're reading or seeing a little bit more about increase on suicide attempts or suicide completion related to inhalants, and that there's a lot of dangerousness to bystanders or other folks related to it because of that as well too, which I found was really interesting. Can you talk about that for just a second?
Yeah, so it was kind of brought to my attention, outside of my clinical practice, actually, of a young person that suicided. Um, it's not necessarily a new phenomenon, as I'm doing a little early research on. Actually, kind of started overseas, and has moved more into this country. So it is inhaled, speaking of inhalants as we are today, but it's generally mixing household chemicals and causing a reaction that produces a gas and is then, released into the room. And it's a lethal gas that they use for suicide. So I'm doing some research on that, and would certainly like to bring that back to, community mental health and maybe the greater community as an educational tool, because the types of chemicals that you are using, as Adrian referenced, are very dangerous. In fact, people that come in contact with the room afterwards have to be decontaminated even. So whether it's parents, friends, EMS, police, other first responders, it can become very dangerous to them as well. So certainly something I'm researching and would love to bring to the community as an educational tool later on down the road.
Right. It sounds like it's something that's, appearing more and more, and certainly important to know, and things that don't always stand out on our minds is things to keep in mind, especially like you said, there's the concern for the individual itself, but there's also the concern for other people around that might be exposed to as well too. Okay. You had mentioned this, that there are some contraindications or some risks with other medications like ED meds or stimulants. Anything else related to contraindications with any psychiatric medications?
Generally, no. Those were the two, direct categories of interaction. But generally, no, not a direct interaction with our other psychotropic or psychiatric medications.
Generally speaking, what type of brain damage occurs when using these types of inhalants?
Um, so specifically, I believe it's the gray matter of the brain that's damaged, which can, depending on what damaged area, that can um, lead to memory and more heightened mood disorders down the road.
Any thoughts on compounding effects of even use patterns related to older adults, maybe 55 and plus?
I guess I'm curious what the questioner was getting at with that one. Compounding with other substances or other medical disorders.
Okay, we'll wait and see if I think it was Ben who wanted to, if you want to go ahead and extend on that a little bit more, we can revisit that with Dr. Moore. What would be your recommendations for identifying students using these substances in school? What warning signs should staff look out for?
Um, I mean, the obvious odors and things that we talked about, and I'm not saying, you know, again, I work on cars and stuff. I'm not saying that everybody should be identified if they, smell of, gas or oil, maybe they just, like to work on stuff. But if it's persistent, and you're seeing other things along with that, drastic changes in mood. And I think one of the important signs is that rapid weight loss. Um, because it decreases appetite. So that can be one of the early warning signs as well.
One thing that I found interesting too, just piggybacking on that, Dr. Moore, is a few years ago, we had some of our local coaches and athletic directors seek out to see if there was any trainings for coaches surrounding mental health and substance use. And what some of the coaches in the area were sharing is that they were finding in the locker rooms like pieces of paper or little things kind of laying around. And what it ended up being is they believe that some of the athletes were doing some kind of sniffing or inhaling, maybe before competing. So I don't know what they would be using, or maybe if you could speak to that, because maybe that would be something that, adults wouldn't see or look out for in locker rooms or classrooms or different organizations like that. And what would that be that maybe they would be sniffing? Would you have any idea?
Um, so, thinking of sports and I guess competitive advantage and things, it could be the amyl nitrites that we talked about. Certainly vasodilation, can give you performance edge on, running and things. So I could see it in that sense. But also more the stimulant. So it doesn't act the same as stimulant, but the stimulant affects the high, and just getting, kind of hyped up for performance, I guess. So that could apply to really any of the stimulants we discussed. But if it's on a paper, like you were saying, Adrian, that would point me more in the direction of, yeah, maybe the amyl nitrites.
And then I lost my train of thought for a second. I had a question about that, but we'll go ahead and go over. But so for just good, like I said, for like folks to know, because nobody really knew what was going on at the time and couldn't quite figure out why there were, little pieces of paper and things like, around the area. So that's really good to know. Oh, I know what I wanted to ask. You had used the word, I think it was vasodilation several times. So for those individuals who maybe don't know what that word means, what does that mean?
Yeah, so the process is it actually dilates the vessels in your body. So two things that it makes the easier for a larger volume of blood to be pumped into that area. And it also relaxes the area. So again, I mentioned, kind of the sexual practices with amyl nitrites. So that's vasodilation in the genital areas, which is going to increase sensation, pleasure, but also decrease pain potentially at the same time. So that's why those are specifically used in sexual practices.
Thank you. Somebody commented that they believe Meyer, if you have to be 18 and over to buy computer duster and cleaner, and that they've noticed that some Home Depots actually ask for IDs for certain paints and things like that as well too. We had talked about brain damage, and someone is asking if there is brain damage, is it something that's reversible?
Generally, it is thought to not be. Yeah, unfortunately, our brain doesn't really regenerate. It can make some new neural connections, but once that tissue is damaged, it's hard to get that back.
Someone had asked him, can you share any additional information about kratom? I've heard very mixed information about it being harmful or beneficial.
So yeah, I did mention it. And kratom's an interesting one. And we could get into a whole nother lecture just on that. So kratom's marketed for a lot of things, very commonly found easily in pretty much any smoke shop in town probably has kratom on the shelf. Marketed for things like anxiety, pain, several different uses. Um, I believe it's actually developed from a leaf, but we're seeing it more and more as a substance of abuse. So they begin using it. It provides an opiate-like effect, so a mild opiate-like effect. So your opiate pain medications, and we're seeing a lot of overuse in that, and becoming a substance of abuse, not just a recreational supplement as it's sold as.
Someone also just commented, like what you had talked about, Dr. Moore, is really one of the best ways to detect use or the signs about sniffers is really based on a lot of self-reporting. And the fact that you had talked about, being able to ask the question and not being so narrow on what we think substance use is. And I mean, as a parent myself, just listening to this, you hear a lot of parents, if they're concerned, they ask their kids, are you drinking? Are you smoking pot? But not really thinking broader questions to ask about sniffers, and really broadening that the way that we're asking questions, not only with the individuals that we're working with in kind of a therapy or a therapeutic perspective, but also parents, teachers, people that come in contact with anyone. And I like the fact that, we had alluded to or mentioned the fact that it's not just teenagers, it can be anybody, it can be older folks as well doing this. Another individual just said that, I have a statement more than a question, that he had an individual that he worked with that actually passed out inhaling aerosols while driving and crashed into a car at a red light. And when this individual was searched, his car was full of empty aerosol cans. So just a situation where that was involved. Another person had shared that unfortunately a family friend was huffing on a can of air, passed out. The can kept spraying after they passed out, and that individual actually passed away, and no one knew that the individual was, suffering from addiction, just because it can be so easily hid. Yeah.
That's
A
really
lot.
the unfortunate part about these is, like I said, they're very easily, one of the first things, used as a substance of abuse and very easily hid.
Mhm, mhm.
My
Someone else
experience
said,
though is the more direct you are, a lot of people have been open about their use, if the question's triggered, Sometimes you just have to get there, with your line of questioning and working with them. Um, but sometimes it's more confrontational, if they deny use and you see, again, going back to those ER cases I've seen where they've had blisters on their fingers and stuff, confronting them and to say, and you can even say, hey, my experiences those occur from using, dusters and other things. Is that something you're or have used? So sometimes it does have to be in a little bit more of a confrontational manner.
And someone else had commented that they know of an individual who used a duster while in the bathtub and ended up drowning and passing away too. Yeah. Also as a parent, it's interesting because I look at some of the pictures and things that you're showing, and I appreciate that you show pictures because if I saw that laying around somewhere, those little bottles, I would think maybe it was an energy drink shot. I would have absolutely no idea that that would be something else. So I appreciate the fact that you use pictures, and I'm kind of hoping that, if this really interests folks, really kind of look and see what these can show as or be. And so showing the pictures is a great idea, and appreciate that as well too.
Absolutely. Yeah, they are overlooked, they don't look that much different from, although maybe a little smaller than like a 5-hour energy shot, but the labeling looks very similar to stuff like that. Um, I will say, I've seen a lot of, disguising methods also. Things that look like a can of pop where the bottom, pops off or screws off. Sometimes the lid even pops like a pop can. But it's hollow inside. And you know, eh, personally, I think those things are marketed, towards teenagers. I think they're terrible, but to Adrian's point, I think those of us that work in, you know, child adolescent mental health, schools, or parents, I think should be aware of those types of things.
That's a great point, Dr. Moore. I know we have had presentations in the past in our recovery summit where we've had local law enforcement talk about trends and different things, and they actually showed a lot of pictures and things, and actually showed on the screen different types of peanut butter jars and pop cans and so many different ways, even things that look like a USB plug-in that people are hiding or disguising as different things. So it's good to be able to be on the lookout and just be aware of that stuff as community members for sure. Okay.
Yeah, some of those, vape pens, yeah, look like USB drives, highlighters or pens. And some of them are functional. They write a little bit, or highlight a little bit. But the other end can be a vape pen.
Mhm.
So, they're getting very clever in their marketing and disguising. So, things to be aware of for sure.
Clever and scary at the same time, isn't it? That's for
Indeed.
sure. Yeah, absolutely. Well, we're kind of drawing to an end. I don't see any other questions at this time, but definitely a lot of thank yous for teaching on this subject. I know that I've been involved in the Recovery Summit for St. Clair County Community Mental Health since it started, and we've had nothing really. We've mentioned about inhalants and other things, but we've never had a complete session on that. I know I've learned a lot. I'm kind of making the assumption that a lot of other people had, a lot of people saying that they've learned a lot of really great information. We've had some people ask about the PowerPoint and the materials, and I just want to remind everyone that the majority of our Recovery Summit webinars, upon the approval or the okay of the presenter, which Dr. Moore has given us, that this will be taped. So if you were able to go back later on in like a week or so into our sccmh.org and look under the Recovery Summit, there will be the taped recordings of the webinars that have been presented on, as well as the PowerPoint presentations, because that's another question. Dr. Moore, so much really good information. People are hoping they can get their hands on a copy of the PowerPoint as well too, so that they can hopefully take a look at it or maybe pass it on to other people as well.
Absolutely.
Great. All right, so with that being said, we are going to wind down our webinar presentation today. So we definitely want to say a thank you to Dr. Moore again. He is our medical director for St. Clair County Community Mental Health, for taking the time, clearly doing research about this and being able to pass all of this on to us. So thank you very much. And thanks for everyone for attending the session today. We hope you found the information really informative and hopefully very valuable as well. So again, today's presentation is one of many webinars scheduled throughout Recovery Month, which is the month of September. To see information and to register for the rest of the additional trainings, because there's still a good handful more, please visit our website at www.scccmh.org under the events tab, and then you're going to want to look for the Recovery Summit. Before we wrap up, we would greatly appreciate all of your feedback, whether you're requesting professional credits or attending as a community member, a parent. We really want to hear your feedback. So a survey, when we are done with the session today, will pop up on your screen shortly. I promise you it'll only take a minute or two to do, but the information that we get back as the planners of the summit is so very important and so valuable. So we kindly ask that you take a few minutes to complete it. Your input is crucial in helping us improve any future events, trainings, webinars, things like that to be able to meet your need. And for those of you, as a reminder that are requesting professional credits, please allow about 2 to 3 weeks after the summit has concluded. So that means the end of September, because I believe our last presentation's on the 27th. So about 2 weeks after that, you will have your certificate emailed to you. It will be one page with all of the sessions that you attended. So thanks again, everyone, for joining us today. Thank you, Dr. Moore, and hopefully we look forward to seeing Dr. Moore present again in the future and all of you at a future webinar. Thanks so much.
Thank you.